So the other day, I guess this might have been in Saturday's paper, Allison Haynes writing a column about, but something we have talked about in the past. We were talking about nursing the other day and how the government seems to be on the one hand saying we want more nurses and on the other hand preventing more nurses or enticing them from getting into the system by actually reducing their pay upon graduation.
Outrageous.
Now a story, quoting our next guest, Dr. Michael KALIN, that the PREM, the license you need to show where in Quebec you can, in fact, be allowed to practice, is actually doing the same thing, preventing doctors from going ahead and practicing here and forcing many of them to leave. Dr. KALIN is on the line. Thanks for being with us this afternoon.
My pleasure.
Can we begin by talking about, for people who don't understand, we call it the PREM. What exactly is this and what does it allow you to do in Quebec as a graduating doctor?
In order to practice in Quebec, you need a license, and this license is called the PREM. It was put into place about 20 years ago by Minister Legault, who was the Minister of Health at the time for the PQ government. And it was designed to prevent doctors from going to urban centers and leaving rural areas without doctors. So it really limited the number of doctors who could go to certain regions and would entice them to go to maybe places like the Gaspésie. What we found now is that these regions, those remote regions, are well-staffed, while urban centers like Montreal are vastly, vastly underserved.
And you're making the point from what I read here that it's time to get rid of the PREM. It did what it had to do 20 years ago when it was introduced, but now it's actually working against more people, certainly in Montreal, being able to find doctors.
Exactly. It's been well publicized that more than 1 million Quebecers don't have a family doctor. And if you look at Montreal and you look at the waiting list, we have about only 63% of Montrealers have a family doctor. That's astounding. I mean, it's extremely upsetting. We're talking about a major metropolis, and yet very significant people don't have a family doctor. So when we look at the number of spots that are being allocated by the government each year, Montreal is chronically underserviced. Last year, in 2022, and this year, 2023, only 85 new spots were opened up for Montreal. This is irrespective of people retiring and people moving. We've calculated that we are 350 doctors short in Montreal, yet we can only put in 85 spots this year. That's how many we got last year. We have 77 people, graduates, residents in family medicine at McGill alone. We have UDM as well. We can't even give enough spots to the people going through our programs. These are locals. These are Quebecers who we've trained over 6 years or longer, and when they've completed their training, we're not even giving them a job.
I really struggle to understand then. I mean, it's illogical. And I look at your suggestion to get rid of the PREM. That is totally logical. So why is it not happening? Why is the resistance there?
Well, I think that there's been a lot of pressure that Montreal will take up all of these spots and all these young doctors, and this will be at the expense of the regions. And maybe you could argue that from 20 years ago, but Montreal's been at a disadvantage for 20 years, and it's really added up over time. We can't forget as well that Montreal serves a lot of people who don't live on the island. Mm-hmm. In fact, 1/3 of the patients who we see don't live in Montreal. Maybe they work here, maybe they used to live here and their family doctor is here. The point is Montreal is a center for healthcare, and we need to make sure that we're adequately staffed. Why don't they give PREMs? Well, I believe that there's a lot of political pressures, and I think that when we think about elections and votes, maybe it's not as popular to give doctors to a center like Montreal as opposed to maybe other voter-rich regions.
Mm-hmm. Mm-hmm.
The part that doesn't, the catch-22 on this is you have a minister and you have a premier in this province saying we need more people, we need more nurses, we need more doctors, yet shooting themselves in the foot at the same time with the kinds of policies that are actually now in effect. Natasha asked, how do we fix this? I'm trying to understand here. You have students going, for example, to med school at McGill. They graduate, and from the article I read, Michael, it basically says as well, they've given up even applying for a PREM because they know how, it's going to take forever or not happen at all, and they end up leaving. It makes zero sense.
It's incredibly upsetting. We think of 77 residents in McGill this year. Only 29 of them have matched. 29 of 77, that's 38%. 14 are unmatched. 7 went private. 3 are leaving the province. 10 are taking time off. 12 are going to do additional training. Maybe they'll come back to the system. That's horrible. These are people who we have invested in, who we've trained, we've paid for their education. They want to stay, and yet we're not even giving them a job. When Minister Legault was talking about the Maisonneuve Rosemont, nursing crisis, he said, you have to be patient. We have to train these nurses. We have trained doctors. We're just not giving them jobs.
I mean, honestly, it's outrageous.
And
it's
I'm trying to understand, where's the opposition on this? I mean, we're talking about this now. People have read this in the paper over the weekend. Are you getting some, at least some reaction, anything from the opposition, from anybody?
Oh, I think people are very upset. And certainly if we look at, the political parties who've been in power for the last 20 years, the Liberals didn't change it, the PQ didn't change it, and maybe the CAQ will. Perhaps we'll see some great leadership, some vision here to realize that a policy that's 20 years old is no longer applicable today. And I think we have to look at the realities of what we have right now. Montreal is in desperate need. We have sécheresse days where we need doctors to cover these beds. Our hospitals are overflowing. We need doctors in the emergency rooms. These are staffed by family doctors for the large part. And when we turn away people and they go to other provinces, these are opportunities lost. And we've invested in these young students, these residents. They're demoralized, they're discouraged, and like you said earlier, they're not even applying for the PREM now because the process becomes so arduous. And I think we have to look at this and say, we have people here. We talk about bringing in foreign doctors. That's important. We have local doctors who we could bring in first, and these are people who've been trained by us. They've grown up in these neighborhoods. They want to serve the community. And it just seems to me it's a no-brainer. If we could just suspend the PREMs, allow these students to go where they're needed right now, it will make an instant impact.
But if it is such a no-brainer and this situation has existed for so long, what makes you think that the change will happen now when it hasn't happened prior to this?
I think Minister Dubé is different from the other health ministers.
Okay.
I think he's very, very committed to access, and we've seen that with the new GAP or Guichet Access Populationnel program. He recognizes that this one-third of the population without a family doctor is being denied care. And this results in deaths. This results in overflowing of the emergency rooms. And I think he sees a different reality on the ground. And I think that this is a priority to him. This is what I hope. And I'm certainly hearing possible movement on this file. We can only hope so. But you're right. This has been embedded in our system for 20 years, and we have to somehow change this culture. It doesn't exist anywhere else in Canada. I mean, can you imagine being told that you can only practice in a certain place? It's not even in the island of Montreal. It's in a region of Montreal. If you get a PREM to work in Côte-St-Luc, you can't work in St. Laurent. You can't work in Dollard. You can't work in Montreal East. You have to devote the majority of your billing to that region. It decreases mobility. When doctors go away on vacation or are sick, it's very hard to find replacements because doctors don't have the ability to move because of these licenses. So it creates a whole bag of problems. And we have to find a way to remove this. And then by doing so, we can bring in more doctors to help us in these urgent places and urgent needs.
Yeah, and by the way, to add to all of that, as if that wasn't enough, we now have so many doctors retiring or leaving the system altogether, they're going to need to be replaced as well.
Yeah, and I heard something the other day that's a bit of a misnomer. Somebody was, I read a message where somebody implied that the older doctors hold PREMs and therefore new doctors cannot replace them. That's actually not the case. The older doctors, they predate the PREM system. But the PREMs are not related to the number of doctors retiring at all. So if we have 100 doctors retiring next year, we're not going to get 100 PREMs. We've got 85 this year. And compared to 2 years ago, that's 30 fewer. Yeah. So Montreal has been penalized. We're getting even fewer PREMs than we used to, while our needs are going up and up. And we saw what happened in November. Our emergency rooms are running over 200% capacity. This is Canada. This is Montreal. We're supposed to have a world-class healthcare system. And we really have to question that. And there are ways that we can change it immediately. We have residents who are getting wined and dined by private clinics right now. We need to be able to come to them and say, we would like to give you a job. We want you in our system. We need you in our system.
Dr. Michael KALIN, Montreal area GP, thank you so much for your time. Very much appreciate it.
My pleasure. Thank
All
you.
right. Look, there's
Let's hope Dubé is
here we
listening.
go again, or here we go still. Maybe
but-
is the better description, right?
I feel like it's being said more often
Yeah,
and,
well-
more, and more loudly.
I think he scores some points for Francois Legault, considering, as the doctor said, he's the one who brought this into effect when he was health minister back in the last PQ government.
So for him to be the
Step
one to
up,
recognize,
fix this now. Yeah.